how does CBT help? Because stress being a trigger, I find that some of the tenets of CBT that we can incorporate for patients with our TRT protocol or our tinnitus retraining therapy can really help. How have you seen CBT be helpful?
First of all, just the fact that tinnitus relief, getting that wound healed from the inside out and getting that auditory system desensitized is not an overnight thing. And so while your tinnitus is coming down, having tools and understanding what's happening. So tinnitus inherently kind of does this. It's not just for most people, it's not just like I have it and it's just constant and it never changes. Um, I never think of it or I always think of it. It it fluctuates. And sound therapy is really helpful, but cognitive tools in your toolbox for any chronic condition. There's not a one size fits all. This is going to be the thing that's going to help you and it's going to give you total relief. You might have a stressful event that comes up and we need to give you, and your tinnitus is going to spike. And instead of you going, which is what would happen before, instead of going, oh my gosh, my tinnitus went up, is it going to stay up? What's it going to do? Having tools to know, okay, I'm stressed out. It's the holidays. I'm going to do some box breathing, or I'm going to give myself 5 minutes a day to just kind of calm down and do some meditation and mindfulness. Those things can help give control back to you and take it away from the tinnitus because inherently your tinnitus kind of wants to take the control back. But the tools
Mhm.
from cognitive behavioral therapy give you the power back so that the
Mhm.
tinnitus isn't in control anymore. You're in control of it.
Yeah, I love that. And it's really changing how we think about the symptoms that we're experiencing, right? Instead of woe is me or oh my gosh, I can't do anything and it's going to ruin my day.
Yeah.
No, I've got tools. I know what to do. I've been here before. I've been able to lower the intensity by taking a walk or guided imagery, or like you're
Yeah.
saying, deep breathing exercises. There's
Yeah.
so many different things that can potentially help someone if they're just open to it, right? You
Yeah.
got to be open to these things. You got to try new things. You got to be willing to take some hard look at maybe how you're thinking and how you're labeling and how you have an emotional response to your
Yeah.
tinnitus. But I think tenets of cognitive behavioral therapy have really helped a lot of our patients with that final kind of plan of how am I going to deal with this long term other than, I need to correct the missing input where the
Yeah.
hearing aids, I need the sound therapy to calm my nervous system down. And when I have triggers, I know I can go to this, particular exercise or this skill and get it back in control. So
Yeah.
it's like you're saying, it's not any one thing and no two people are the same,
Yep.
but we got to be open to these options for sure. And I think the last two the article mentions are centered around diet. So the article mentions the Mediterranean diet as being
Mhm.
helpful to tinnitus and limiting alcohol and nicotine as being treatment options for tinnitus. So why would they say that? What do you think about that?
I mean, the Mediterranean diet, I think I used to work with a really good neuro-otologist who he talked about that because just good, healthy things going to your ear, the metabolism and the metabolic rate in the cochlea is not great. And so, um, feeding it with good things that help promote so things with lots of antioxidants that help promote, this high cell turnover rate as much as we can. So that's what the Mediterranean diet's doing is it's focusing on good fats, good healthy things so that that can get to our ears instead of things that can constrict blood flow. So the blood flow and
Hmm.
that kind of goes to smoking. The blood
Hmm.
flow to the ear is inherently really poor. And so
Hmm.
it doesn't take much to alter the blood flow to the ear that can cause long-term damage. Once the ear is damaged, you typically don't get it back. So,
Yeah.
um, we want to try to promote good blood flow, lack of inflammation, so that all of that can trickle down to the ear. And the ear it's a major protective mechanism for our body and for our fight or flight reflex. And so it's important from a metabolic standpoint that low Smoking, drinking, things that we know are proven to not be good for us are not good for our ears either. So,
Right.
yeah, I think the more you can do just to live a healthy lifestyle in general is better. But, lots of vitamins and minerals and healthy fats, uh, reduce the cell dying process in the inner ear that can happen when you don't eat as well and when you damage your system with things like smoking and drinking, and we know those aren't diabetes, those things aren't good for our body long term.
Yeah. Yeah. And just improving vascular function, like you said, right? We want, I don't think people appreciate, because again, we're not probably taught this in school, but there's only one blood supply to the inner ear, right?
Yeah,
There's only one cochlear artery. And so
yeah,
if you have compromised vascular function, if you have elevated blood pressure and like you said, diabetes and other things that are going on in your system, it can lead to damage to the inner ear, and
quickly.
damage to the inner
Yeah,
ear can lead to tinnitus.
yeah,
So,
yeah.
yeah, the more healthy we can be in terms of our diet, and there's of course always the unique cases. I had one patient; she had Meniere's disease. She was young; she was a high schooler, and with
Oh,
Meniere's suddenly. And so she had horrible tinnitus, fluctuating hearing loss, vertigo. And I just kind of looked at her and I said, would you be open to talking to a nutritionist? Because I think something's going on here with your diet. I'm not sure, but you're just so young, and you're a senior in high school. You're trying to get off to college and these symptoms are debilitating. Would you meet with a nutritionist? And lo and behold, she came back to me at the end of the summer, and she had lost like 30 pounds because she had all this inflammation, and found out that she was, gluten and dairy intolerant. And when
yeah,
she removed those from her diet, her vertigo was like non-existent. Her tinnitus was
amazing.
much less.
Yeah,
Her hearing loss didn't fluctuate as much. And she was like a new person. And so you just never know. If you suspect your diet could, maybe you have some food sensitivities that you've been thinking about but have never really talked to anybody about it, meet with a nutritionist. Just
yeah,
see, is there anything that I could be doing differently to make myself feel better and healthier? Because you never know if that could contribute. I
yeah,
mean, most people today that I meet are actually pretty healthy, and
yeah,
they're very aware of being healthy with their diet and exercise. But if you're kind of new to this thought process, you just never know if something you're doing unintentionally
right.
could be impacting you. And so I just remember seeing her, and she, was so appreciative because she said, "Nope, I don't know why none of my doctors told me to look at my diet and talk to a nutritionist, but that made a huge difference." Instead of just, usually with Meniere's, as you're aware, that's take a diuretic for the fluid buildup, and here's some Valium for your vertigo
Yeah,
spells. And it's like, it's more just, let's give you some pills for these symptoms, instead of like, why am I getting such drastic symptoms in the first place?
totally.
So
I think the ear is, sensitive to stuff going on in the body. And so
absolutely.
when you go to somebody who knows what they're doing and they can look holistically at what's going on, I think of tinnitus a lot of times as like a canary in a coal mine. It's um, reacting to changes in our body that we should pay attention to. Is it just the hearing loss? Is it that you have some other unhealthy habits? Like, what is it? But we can look at it holistically, but it really is symptomatic of more than just, oh, yeah, your ears are ringing. And so I think I think that your example of a nutritionist is totally spot on.
Well, and yeah, I think kind of in conclusion, I think we all just have seen how sometimes in really complex cases, we need to look at more of a multidisciplinary team, right?
Totally.
Approach to treatment of,
Yeah.
I can help you with everything audiologically based. I can even help you with some tenets of cognitive behavioral therapy. But if you have stress from, a past situation like abuse, then if you have those predispositions for anxiety disorders or anything, we might need the help of licensed therapists to also come alongside of you
Yeah.
and deal with some of those issues that came about before the tinnitus onset, right? So
Yep.
just being open-minded, I think, is important for tinnitus patients. Like we keep saying, there's no one-size-fits-all approach here, but when you work with a tinnitus expert who has experience in this,
Yeah.
we can really help guide you in the right direction and
Yeah.
get your treatment started and get you on the right path. And you don't have to be hopeless. You're not alone, right? We help so many people, and I still see, on our YouTube channel and different places where patients will say, there is no
Mhm.
treatment for tinnitus. Why are you keep saying there's treatment for tinnitus? Because there
Oh, there
is, and we
is.
have helped thousands of people with tinnitus. And so I just want to make sure people realize you're not alone. We're here to help. There are options that work
Yeah.
100%. We wouldn't
Yeah.
be here. We wouldn't be, right.
Yeah.
Sound Relief wouldn't still be in existence if we weren't able to
No.
help people. So the first step is you just have to come in
Yeah.
and talk with us, right? And get an evaluation done so we know how to point you in the right direction, how to get you started,
Yeah.
and then we can go through these different treatment options and align which ones will work best for you.
Yep.
So
Yep. I totally
that's
agree.
kind of why we're here, right, Dr. Abby?
Yep, and
So,
I always feel so happy because it's usually a path. It takes people a while to get in that chair in front of us, and so when they get in
mhm,
that chair in front of us, I'm always so excited and so happy that they found us. Even if they're skeptical and they're like, "I've been to 5 places and nobody's been able to help me." I love being able to say, "You're in the right place. We have all the tools that we need to be able to help you.
yep,
You're not unique. I mean, you
yeah,
are unique, but you're not somebody who it's like, "Oh, I no, you're right, we can't help you." We have all of the know-how, um, to be able to help people with no matter what they come to us with, which is so
yep,
cool of we also know when we don't know enough, and we know that, "Okay, well, here's
mhm,
what I know and here's what I can help you with," but like you said, we're gonna do this concurrently with another specialist who can deal with this that's going on. And so we just are so good at guiding people to relief, no matter how they need to get there.
yep,
And I feel so proud to be able to have the know-how and the wherewithal to be able to get people better
yeah,
and that they find us and that we advertise so that they know that there's things that can be done and that narrative of tinnitus isn't treatable is wrong.
yep, yep. That's what we do.
So we
That's what
do
we do.
every
Yeah,
day. Every
yeah,
day we prove that wrong.
yep. It's
Yeah.
pretty rewarding for
Yeah, it's
sure.
awesome.